everyone, and welcome to our show, Coffee Break. Today we are excited to have Dara Torres, who is a mom and a 12-time Olympic gold medalist, both amazing accomplishments, and Dr. Shane Chapman, Section Chief of Dermatology at Dartmouth Hitchcock Medical Center. I'm your host, Todd Bello, and I'm an ambassador for the National Psoriasis Foundation. And I'm also the founder of our support group, Overcoming Psoriasis. Dara, I just have to say you're such an inspiration to our psoriasis community, and thank you so much for your advocacy work.
Oh, thanks. That's very kind to say.
Awesome. Could you please just tell us a little bit about your history?
Sure. So back in the early 90s, I noticed these red patches on my elbows and flaky skin and very itchy, and I really wasn't sure what it was. So I just kind of let it go. I figured, there's got to be something in the chlorine or some new chemical. But then after a couple months, I put lotion on it. It didn't go away. So, and I also noticed that other swimmers didn't have it. So I decided to see my dermatologist, and sure enough, I was diagnosed with psoriasis, which for me, it's triggered by stress. But you have to understand that my business suit is my swimsuit. So being on a pool deck with psoriasis, I have to tell you, back in the early 90s, I was a little embarrassed. And also, people didn't really talk about psoriasis back then. So I just realized very early on that I really shouldn't care what people think, and just know that I have to have the confidence to be comfortable in my own skin.
Terrific. So how did psoriasis affect your self-confidence and your ability to compete as an Olympian?
Well, that's what I just kind of meant was that, you have to be comfortable in your own skin. And being in a swimsuit, everything you see is right there in front of you. So I think my biggest fear wasn't so much what people thought of me. It was the fact that, did they think, can they get this if they touch me? Or if I go in the pool, are they going to get psoriasis too? So that was more concerning for me than anything. But I learned really quickly that I just can't care what other people think, and I just need to focus on the task at hand, which for me was going for another Olympic team.
Yeah, that brings up my question. Did any of your teammates or competitors make comments about your psoriasis?
I think I think it's probably different now than it was back then. And back then, you just didn't really talk about it. But you can see people sort of looking at you. And, I think at first I tried to cover it up a little bit. But then again, I was living in Florida, and it's very hot there. So it's hard to cover up too much. But, I just learned that you just can't worry about what other people are thinking or saying.
Yeah, and Dara, psoriasis, did it ever cause you to miss a practice or competition?
No, it didn't. But I definitely noticed when a competition was coming up, it would definitely flare up because I was extremely stressed out. And for me personally, when I have stress, I need to somehow try to relieve it so the symptoms will decrease. And I just go exercise. That's the best thing for me to do, is to exercise to try to relieve the stress.
Sounds great. Also, what advice could you give someone who is newly diagnosed with psoriasis?
Well, my advice is to go to showmoreofyou.com, which is the campaign that I've teamed up with Celgene and Otezla to talk about. It's a wonderful website. If you go on there, you'll see that we did a photo shoot with famed photographer Martin Scholler, myself, along with 4 other people suffering with psoriatic disease. It was really a fun day, but also we were able to bond and talk about our psoriasis and psoriatic arthritis stories. So it was very meaningful. But if you go to moreofyou.com, you can see the photos that we took that day. But there are also a lot of people suffering from psoriatic disease who have uploaded their photos, have shared their stories that they've had to deal with. And it's just very inspiring. Plus, people who don't know what psoriatic disease is can learn a lot from this website.
Perfect. Dara, I have one more question from a member. Her name is Megan. Goes on to say she's married for 9 years and has a 3-year-old. Her husband is very supportive about her psoriasis, but she can't help but feel ugly and self-conscious. He tells her constantly that he loves her and she's beautiful. She would like to ask, how do you get past the self-consciousness to once again enjoy intimacy with her husband?
You have to love yourself too. And the fact that her husband's so supportive, she needs to take his word and understand that he's there for her no matter what she has on her skin. She's still beautiful to him. And, I have a 11-year-old who, has been around the psoriasis because her father has it too, much worse than I do. And, we've had to kind of talk to her. And so I hope she's open with her daughter when her daughter can understand sort of what it is.
That's amazing.
And Todd, if
Chapman,
yeah, sure. Sorry.
I have some questions for you.
Sure.
Thank you so much for your work with psoriasis and psoriatic arthritis. The psoriasis community really appreciates it. Could you tell us a little bit about psoriasis and psoriatic arthritis?
Sure. So the two component psoriatic disease, and one is skin and one is of the joints. Psoriasis It's very common. It's a chronic condition. It affects about 7 to 8 million Americans. It's an inflammatory process. Some people think of it as an autoimmune disease, but it's inflammation of the skin that causes the skin to grow rapidly and scale and develop these plaques. Very noticeable, sometimes painful, very itchy. The psoriatic arthritis is the same type of inflammation of the joints. It's usually in the small joints of the digits, the hands and feet, but sometimes the larger joints in the hips and the back or the spine. And combining those two inflammatory pathways, we call it psoriatic disease. Some patients who have psoriasis, about 30% actually, will go on to develop psoriatic arthritis in their lifetime.
Okay, is psoriatic disease contagious?
Psoriatic disease is not contagious. It probably is, should be considered a hereditary disease where you have a certain genetic background that predisposes you to the inflammation. And if you come in contact with different environmental factors over your lifetime, you may develop psoriasis. But it's definitely not contagious. Patients who have it, obviously they know this, but friends, family, etc. need to know that as well, because there's a lot of myths about that.
Perfect. What advice can you give a patient who is struggling with psoriatic disease?
I would tell them this. 20 years ago, we didn't really have great therapy. These days, we have really great therapy with the biologics, which are injectable medications. We have oral medications. We're developing new medications all the time. Otezla is a great place to start for my patients, especially if they don't want to use a biologic or have a needle or an injection as a first-line therapy. It's a very safe medication. The safety profile is excellent. Patients really like taking a pill over an injection, and there's no laboratory monitoring.
Great advice. So at what point does a person need to seek professional help before it's too late?
Well, I never think it's too late. I think when it's bothering you, when psoriasis or arthritis is bothering your life and your choices in life, whether to go outside or to wear shorts or go to the beach or whatever you like to do, to me, when it starts to impact those choices in your life, that's when you should seek help. And I think patients who have significant psoriasis of the skin, they should go see their dermatologist. And if you have really painful psoriatic arthritis, they should see a joint doctor or a rheumatologist.
Terrific. What are some of the comorbidities associated with psoriasis besides the ones you mentioned?
So psoriasis is the skin component. Psoriatic arthritis is the joint component. There are multiple comorbidities, and we're finding out more and more about psoriatic disease. Heart disease is one. There is a very slight association with lymphomas. Psoriasis patients need to know that. It's very small, but patients need to know that. There's a slightly increased risk of diabetes and obesity as well. So we're learning more and more about psoriasis. And again, not everybody has the same symptoms. Certain genetic mixture, you might just have the skin disease, and another genetic mixture, you may have all of these comorbidities. And we continue to learn more and more about that.
That's terrific. And what do you think about the fatigue and depression aspect? That's also something that I struggle with too.
So people don't talk about that a lot, but psoriasis patients definitely have a higher rate of depression. When you have inflammation in your body, like we're talking about, you tend to be more fatigued. You either don't sleep well, or you might need too much sleep. And that's another component of psoriasis that people don't like to talk about. The Show More of You campaign is helpful in bringing out all these little subtleties and nuances of the disease. And I think sometimes I enlist internal medicine help, so extra help from my physician colleagues when psoriasis or psoriatic disease is affecting those aspects of patients' lives.
Amazing advice. So that wraps up our coffee break with Dara Torres and Dr. Chapman. Thank you both. I'd also like to thank our sponsor, Celgene, and their campaign, Show More of You. You can go to www.showmoreofyou.com. If you want to know more about me and my psoriasis, please follow my blog at overcomingpsoriasis.com. I'd also like to mention that the National Psoriasis Foundation is celebrating their 50th year. Volunteers from all across the nation will be gathering in Chicago on August 4th and 5th for our National Volunteer Conference. You're all invited. I hope to see both Dara and Dr. Chapman there. Hope to see you there. And have a blessed day. Thank you so much.
Thanks, you too.
Bye-bye.